Okay, today we're talking about ozonated glycerin. So this is magical healing. That's how I think about it. And Dr. Rowan, who's my teacher, would probably agree. Okay, so first a little background. Why would you want to use ozone? How many of you are familiar with ozone? Just to raise hands. Some and not everybody. Okay, great. That's good. Let's look. So when our bodies are aging, we get decreased oxygen utilization. What does that mean? It means our cells aren't taking oxygen up very well. So it's especially in our muscles and organs, and then that leads to lower energy production. Our cells make energy, and then our organs work, and then we can do things. So this happens with aging. So as we age, we get decreased oxygen utilization. It happens when we have chronic dis-ease in the body. It happens if there's like excessive free radical production, that we get pathology. Free radicals are like, I like to think of it of when iron gets exposed to the elements and it rusts, that's like a free radical. It causes that. Organ breakdown, so then that can happen in organs breaking down, and then also in any degenerative diseases. So that's decreased oxygen utilization. So then now what is ozone? Ozone is oxygen. So here we have oxygen. It normally in nature goes 2 molecules together. Ozone is 3 molecules together. In order to make this, you have to force it to happen. It's not a very stable product. And we have ozone generators. So it creates, in the generator, it creates this reaction, and then it forces these 3 oxygen molecules together. And then what easily happens is it will go to O2 and a single O. And this is the magic part of ozone in general. I'll just say briefly, yes, there's ozone in the atmosphere. It's not the same thing, okay? Very different. This is medical application. So how and why is ozone magical? Well, ozone stimulates that oxygen utilization, so it helps your body to use oxygen better, and then it makes these molecules called ozonides, and those then increase energy in your cells, so your cells work better, your organs work better, you feel better. You get more oxygen, just oxygen in general, to the organs and cells. It also helps the immune system, so it decreases inflammation, it helps fight infections, it helps repair injuries and dis-ease. It also activates the body's mechanism to protect us from oxidative stress. So that's that rusting aspect, like with iron. It's also antiviral, antifungal, antimicrobial. Bugs do not get resistant to ozone whatsoever. So it's not like taking an antibiotic where, oh, now this bug is superbug. Does not happen. And also it enhances the effects of chemo and radiation, which is fantastic. The challenge with ozone is that the gas breaks down quickly. If you remember that picture, it goes to that 2 oxygen molecule and 1 oxygen molecule pretty quickly. For example, when I'm doing an IV ozone, when we're taking blood and putting ozone into it, pretty much immediately it goes to oxygen and 1 ozone, or 1 oxygen and 2 oxygens. So it has a short lifespan. Also, ozone gas is toxic. It has to be in high concentrations. So the rule of thumb is you just do not inhale it, okay? So if you all that have ozone machines, you know, okay, I'm not gonna be breathing this in because it's going to seriously irritate your lungs. If that does happen, no worries. Just take a whole bunch of vitamin C. The symptom is coughing. You'll have coughing. And so if you have that happen, just start taking vitamin C and it will help repair. And then you'll learn, okay, I'm not gonna do that again. Okay, let's take it up a notch. Let's go to glycerin. Oh, first I wanna thank, these are my teachers, and Dr. Gotaro Shiota, he's from Japan. He is the doctor that actually brought this OG, ozonated glycerin, over to the United States and started educating us doctors over here. Dr. Jim Bridge, he's a veterinarian. He's the doctor that kind of took the information and ran with it and started applying it in his clinic, and then even brought it more education to us doctors. And then my mentors are Dr. Rowan, Robert Rowan, Dr. Terry Sue, and Dr. Frank Schallenberger. A lot of you probably know Dr. Rowan. You might get his newsletter as well. So I just want to give thanks to them. And some of the slides also are from these doctors. So thank you to them for that. So ozonated glycerin, AKA OG. I'm going to call it OG, so you can call it OG too. All right, so let's talk about the timeline. It was actually discovered in the 1800s, but it was forgotten. So there's some old books about ozone, and they were talking about what's called glycosone, and that's OG. And so they had all these therapies that they were using. So it's not something new. As is, ozone is not new. It was used in the 1800s. But in 2001, the Japanese researchers, they decided to look a little bit further, and they rediscovered it and started creating a shelf-stable product. So you'll see when we get a little bit further stability of OG. And then in 2018, Dr. Shiota brought the research to the US conference, like I mentioned, and then Dr. Bridge started using it more extensively. And then last year, or probably 23, 24, and then this year, then the word's really spreading. So fun facts about glycerin, we'll say, and OG. Glycerin is viscous, it's sweet, so it's a sugar, like a sugar, and it's water soluble, so your body can take it up super easily. To make OG, you bubble ozone through glycerin, and then the glycerin will hold on to the ozone molecules. It's a very stable delivery method of ozone. The half-life of OG is 90 days at room temperature. It is longer when refrigerated, and if I remember correctly, if you freeze it, it's indefinite, so it will be stable. And that's the half-life, okay? It's safe in all applications. The Japanese did a bunch of studies to see, okay, what if we put it in the eye? What if we put it in the skin? What if we put it in the mucous membranes? Does it hurt? Does it damage? No issues whatsoever. It doesn't create any mutations, like it's not cancerous causing or anything like that. Ozone selectively inhibits the growth of cancer cells. Basically what this is doing is that our healthy cells and the cancer cells, when the cancer cells are exposed to ozone, they get eliminated, and then our healthy cells keep living. It is a concentration, it's concentration dependent, but that's fantastic. And also OG and ozone, it kills MRSA, staph, candida, you've heard of yeast infections, pneumonia, biofilms. Those are like these little, do you guys know about biofilms? Oh, they're fun. They're like mucus created with bacteria in it, and it's like it's really fun, and it gets in your digestive tract, it can be on your teeth, and that creates a safe harbor for the bacteria, and it protects them, but OG can go in and get into there and get rid of the bacteria. And also COVID, fantastic for COVID. So the cool thing, Dr. Shiota had these graphs, and they show that when these bugs are exposed to OG, they're dead in a minute. I mean, that's a minute. And you think about, okay, being on antibiotics, you got to be on it for 10 days, all of that. I mean, no, this is a minute. Of course, it's dose dependent too. Okay, let's talk about how you guys can use it, because that's what's important, right? Yeah, exactly. Topical. Look at all those ways you can use it topically. Wound healing, age spots, tumors, anti-inflammatory, like if you have a dermatitis, any type of skin rash. It's antibacterial. It will stop bleeding. It speeds the healing process. So you can, I have pictures where it's like they had pictures of diabetic ulcers where it really healed. Those can take a long time to heal. You can use it as an enema. So like if you have, you could theoretically use it if you have ulceration in the rectum, so maybe for hemorrhoids, or also people that have Crohn's disease. You could also use it for vaginal applications. So women that get HPV, bacterial, BV, bacterial vaginosis, anything like that, you can use it as a douche or saturate the tampon and just apply it that way. Very, very effective. Orally, I mean drinking it and swishing in the mouth. So you can swallow it. So for ulcers, gastric ulcers, you can do that. Dyspepsia, where you have like that uneasy feeling in the stomach, you could use it for that. Any type of chronic inflammation in the gut. And also you could swish it in your mouth. Surgical site, after a dental surgical site, like if you get an implant or a tooth pulled, put it on there, it's going to heal it like that. Nasal spray. You travel, you can make a nasal spray. Cold and flu prevention, loss of smell. Dr. Bridge said he had lost his smell for, I don't know, years, and he was using it and he started to smell. I have a patient that lost their smell during COVID. It's maybe been back about 10%, and he started using this and it's improving. It could smell tobacco, somebody smoking, which, okay, you would think you'd be able to smell smoking. So this has made a big difference. Sinus infections, anything in the sinus area. Nebulizing. A nebulizer it's like a mini air compressor, and you hook up a tube to it, a plastic tube, and then it has a mask. Like you can use an oxygen mask or you can use a mouthpiece, and then it has a medicine cup. So you would put the OG diluted into the medicine cup, and it's a delivery method for medicines. So you can use that for any type of lung infections, pneumonia. Dr. Rowan has a patient that had mycobacterium pneumonia lung infection, super duper challenging to heal. She's gotten significant relief from using that daily. Any type of sinus infection. So sometimes sinus infections go up a little bit higher, so a neti pot won't be able to reach up in the higher sinuses. So that's a great way to get it. Any type of sinus inflammation, you might try it for allergies. It might even cross the blood-brain barrier. So ozone getting into the brain could help decrease inflammation as well. Okay, let's talk about use in the medical office. So in my office, I can do joint injections. So you might know about Prolozone, joint injections using ozone gas. Well, we can also use OG as part of the injection as well, so into the joints. It's only, right now they're saying only into the joints, so not for like trigger points, which we can use Prolozone for trigger point muscle things, works well for that. Around tumors, it will help decrease tumors. Dr. Bridge had several studies and images of his pet patients. They had like big tumors, on their abdomen, right? And he would inject around it. It's called Surround the Dragon for you acupuncture people. You just put needles around, surround it, and then the tumor decreased and resolved. Pretty amazing. You do need to keep doing the treatment, the OG treatment, because it helps keep it at bay. It's not like, okay, it's 100% gone, but it is a fantastic and very safe method. Also for organ healing. So maybe you want to try to stimulate it or support an organ, you could inject it over the organ to help stimulate it as well. And then for IV therapy, fantastic, easy, super duper easy, any type of these chronic infections, long COVID, Lyme, viruses, active COVID, anything like that, let's do an IV OG. Autoimmune diseases, any type of autoimmune disease, ozone's fantastic for them. This is a great treatment. And then also for cancer, I've switched over from doing the IV ozone, the blood treatment, to just doing the IV OG. It's a lot easier to administer, and maybe even it's more effective. The The other injection I will tell you that some doctors are doing, I'm not doing it yet, but I may, is you can inject it what's called intraperitoneally. So our peritoneum is that inner part of our, like, where our organs are, right? Not into the organ, but around them. So you can inject OG in there, and it basically will like bathe the organs in the OG, ozonated glycerin, and help them heal, decrease the inflammation. And that's what Dr. Bridge did with his pet patients. He kept up that intraperitoneal injection, and that would keep the cancer at bay for the pets. But if they got off of the schedule, which he got them to, I think, one time a month, if they got off of that, then the cancer would come back. So it's effective, but need to be doing that regularly. Okay, so how do you use this at home? You don't need to read the fine print. I have a handout if you would really like to see it. But these are all the specifics about how am I going to use it nebulizing? How will I use a nasal spray? How do I drink it? How you could gargle with it. You have some throat issue going on, just gargle with it. Here's other things. Topical, using it over wounds. You can use it at home if somebody has a tumor. You can do a topical application over the tumor. Age spots, I will just note, so you don't have an expectation that that's going to go away in a day. No. It takes a few months. So if you really want to get your age spots to resolve, you need to be consistent with it, but it will start taking the age spots away. Also, you can use it over joints, over tissues, arthritis. I know, if you have any type of joint pain. I also like castor oil for that, so that's another easy peasy thing if you have any joint pain. Also eardrops, so any of those types of things. Okay, and then the last question would be, where do I get OG? Yes, very good question, because I know that was on your mind, right? So you can order it from pureo3.com, and if you use this code REDWOOD, you get a discount. Thanks to Dr. Rowan. I also have it at my office as well. So if you want to have it like right away, then you can get it at the office. Because OG, it takes a little while to make it. Depending upon your volume, they have to bubble the ozone. So you could make it at home, but you have to bubble the ozone through the glycerin for several days. So for example, for 250 milliliters, I think it's about a 3-day process. Now the setup can be a little challenging, as some people in the audience know, but buying it's easy. So, but when you buy it, they want you to have the freshest possible product. So you may order it, and then they'll say, okay, we're going to ship it May 5th. And then they'll ship it that day, and then you'll get it, because that's when they're going to have it ready to go, and then you'll have the freshest possible. If you do order it, I just recommend keep it in the freezer, because it's going to just stay a lot longer, and then you can use it as needed. As far as I'll just tell you one little tip, because it's very thick, and if you need help with all of that, like making it, I have syringes and the proper sizes to make it a little bit easier for you. I have some tips that maybe my plan is to make a video, so you can then go watch it, and then you'll be set to go, and you'll just have an easy peasy time. Okay, great. So that's it. Thank you very much. We'll have questions later, and thanks for your watching me. Karina.
I was just wondering if you have access to ozone gas and you also have ozonated glycerin, is there a time, like say for, something in the head or sinuses or whatever, that you would use one or the other? Because I know you can do ear insufflations.
Ear insufflation is fantastic. Easy to do. Did somebody say, what is that? So with the ozone generator, you can make ozone gas, and so there's an attachment to your tubing that you have, like a stethoscope type attachment, and you can bubble ozone, get ozone into the ears. Fantastic. There's also now there's some new, just FYI for y'all, there's some new products where they have like a more of a headphone type apparatus that also I think will help destruct the ozone gas, because you just don't want to be breathing the gas in, remember, like we said. So I think ozone, the gas is great. When you're out and about, it's easy to do the glycerin, so if you're like out and, oh, I'm having a stuffy nose. Let me grab I'll show you my little nasal thing. Just like with the OG, is it does hang out a little bit longer, so it's a little bit more flexible because you can travel with it. So I bought it online, okay, and it's a nasal spray, so you can fill it and make your own, and then you just, okay, super easy. Yeah. Is that helpful?
Yeah.
Tom?
Yeah, how does ozonated glycerin compare with ozonated olive oil? 'Cause I know some years ozonated olive oil was really readily available.
It still is very available. PromoLifePure03.com. They have ozonated olive oil, ozonated hemp oil, ozonated coconut oil, ozonated castor oil, all very good. They're very great for topical. It does have that ozone smell. OG does not smell like ozone whatsoever.
Uniquely, are they similar?
Very similar, yeah. I don't know the studies, like if you would use topical ozonated olive oil versus the OG. I don't know that the olive oil is going to get rid of those age spots like that. I don't believe it has the same effect on tumors. The primary reason being that cancer cells are more likely to take up sugars than an oil, right? And so it's more for a tumor aspect. If you're applying it topically, it would be more effective. The OG would.
Yeah, that's what I noticed was the different one's water soluble.
Yes. Exactly. Yeah. So the cells can take up the OG a lot. I mean, they're going to take it up a lot easier than an oil, a lipid, a fat, right? Christina?
So do you mix the glycerin with water to make the spray?
That's correct. So on the instructions, what you want to do is make sure you have a clean water source. What do I mean by clean? You can use distilled, yes. Filtered, not chlorinated, none of the things that come out of the tap. Ideally, you want to filter it in some manner. You could just buy distilled water and use that for any of this application. Using it in the nebulizer, the nasal spray, the gargling, it's a little bit different, but yes. Yes, Cher?
Hi. So just overall, you know how it heals so many things. So my question is, are most diseases just caused by lack of oxygen then?
A lot of them, yes. A lot of diseases are, yeah. And aging is decreased oxygen utilization. That's one thing that Dr. Schallenberger, my first ozone teacher, he made that very clear, is like aging is decreased oxygen utilization. So the cells aren't getting that oxygen. They're not able to make the energy. I don't know, maybe you've heard of the ATP cycle? Anybody? Yeah. Okay, so the ATP cycle that's our currency of energy, like money in the body. And so when that starts slowing down as we're aging, then things start breaking down. So, yes.
Is that a follow-up question? You know how like babies, when they're born, they like breathe really deeply, like at the belly, and then as we age, we're just like
that's
shallower and shallower.
Yes, good point. So I should probably repeat the questions for the video. So her question was regarding babies that tend to breathe deeper, but as we age, we don't breathe as deep, so we're not getting as much oxygen in. Yes, that's something that I work with my patients about, because that also then affects our nervous system as well. So then we can go more into fight or flight versus that rest and digest parasympathetic. And so, I mean, there's obviously a lot of factors with aging, but if we're in fight or flight more so, then we're going to be aging more because we're not able to even digest and absorb our food and nutrients, right? And so then our cells are going to be like, wow, we can't function. And so that and then oxygenation, those two really go hand in hand. And deep breathing helps put us in parasympathetic mode if you're doing it right. So if you're breathing up here, right? I don't know if you could see that, but chest breathing, you're not going to go into parasympathetic. You want to do more of those belly breaths. So really feeling your belly going out. Norman?
What's the consistency
Of the glycerin? It's kind of like Caro syrup.
Okay.
Around that.
And you said it's sweet.
Yes.
So,
I was going to bring some and I forgot because I was focused on getting here.
but it's not a sugar? Or?
It's the sugar, yeah, glycol.
Okay,
It's a glycol, yeah.
okay, the
Glycerin.
absorb.
Yeah.
That's awesome. Good.
Yeah. It's a sugar, yeah. And interestingly, just a little side thing, when Dr. Rowan and all the doctors that like geek out on making it and the science part of it, they're like, okay, let's make sure we're not making nitroglycerin. So you're not if you make it. Marianne?
So you're flooding, and this is a question, are you flooding the body with oxygen then? You're like flooding the cells with oxygen? But it doesn't change the function of the cell itself, right?
No.
So if you're older, you're flooding, and then do you have to kind of keep repeating the treatment?
Correct. Yeah. Yes. So, for example, getting an IV or a blood ozone treatment on a regular basis is a very preventative type treatment because you're going to be consistently oxygenating the cells. I'm not 100% sure if getting an IV OG would be very similar. I could imagine it would be. I mean, and they're very simple. They're much easier to administer than the blood ozone. But yes, it would be doing it on a regular basis. So even at home, if you have a machine at home, even doing like ear insufflation, or you can do a rectal insufflation. So like that's a enema with ozone. Doing those things on a regular basis have a very preventative effect.
But doesn't change the uptake rate or anything?
No, it's not like, okay, I don't have to ever do that again. Yeah, no. William?
If you're buying it, is it very expensive?
How expensive is buying OG? I think it's around $60 for a 2-ounce bottle. And so 2 ounces is 60 mLs about. And so, and then you can take, like if you're going to take it orally, you might do a teaspoon a day, or you could do it 2 or 3 times a day. But a teaspoon is going to be 5 ml. So that's going to go pretty quickly. 5 divided into 60 is what, 12. So is that right? Yeah. So it's going to, that'll last you 12 days. That's why it can be great if you have an ozone machine at home and you can get it set up, just make your own because it's going to be way cheaper. But yes. Brian?
What's the concentration when you do it with a nebulizer?
So for the nebulizer, I do have the handout for you guys if you want that. But what we found, and I found this with a patient of mine, because she's, I think, started at a 20 or 25% dilution. You need to start at a 5%, 5 or 10% dilution. The patient that did the 25%, it was just too much. And I think it caused a lot of potential die-off and irritation. She has recovered, but it was just too much. So it's always good, just remember, start low and slow. Don't just like go in because you might have a reaction or response that your body is like, what the heck? And then you're like, oh God, I'm never doing that again. That's not the goal. The goal is for you to try it out, use it, see the benefit, and then like slowly increase. And that's what I do with the IVs. We start low and then increase. Clark.
I think also you take into account, the pharmaceuticals that are given to people to take when they get a disease, they get a problem, and the effects that has on you. And then you take this OG, and it doesn't have those effects. You
Correct.
just have to be heads up on how to use it, not overdo it like you were saying. But so far as the cost, $60 for a little bottle compared to how much going to
Yeah.
Walgreens or whatever and getting whatever drugs your doctor has prescribed for you, there's no comparison.
Very good points. Yeah, very good point. So just for the video audience, it was about how pharmaceuticals, they have their side effects as well. And so just being smart about when you're using the OG, okay, just be aware this could happen, but it's not going to be nearly the side effects of death and dying. You watch those commercials, may cause death or dying. Death, might, yeah, whatever, Yeah, suicidal intentions. OG will never drive you to suicide, let me tell you. It will make you very happy for a happy life. Yes, and I forgot the other, and the cost, yes, comparatively to pharmaceuticals, doctor's appointments, if you're getting imaging, if you have to have surgery, this is nothing. Yes, Jonathan.
And the cost of the ozone machine?
An ozone generator, they have various qualities. I think you can get a pretty basic one around $1,100. They can be all the way up to maybe about $2,300, depending upon all the little gadgets and attachments that you get. Yes, Norman, one more.
You mentioned it crossing the blood-brain barrier. I don't recall if you mentioned anything about like Alzheimer's or dementia or neurodegenerative issues, and if would a nebulizer be best for the blood-brain barrier penetration, or just, I don't know, thoughts?
Yep, sure. The question was regarding OG crossing the blood-brain barrier, potentially for any neurodegenerative diseases, using the nebulizer. Definitely the nebulizer. I use that in my practice regularly with different homeopathics and different supplements, and they definitely do cross the blood-brain barrier. The fact that OG is a sugar, our brain uses sugar, the molecule size, we think some might potentially get through. So I would say the answer would be yes, try it out, see what happens on a daily basis, really. And starting with I would probably do like a 10% solution of that. You can, kind of gauge and go up to maybe a 20%, but just kind of see how people tolerate it and follow up. Yes.
Follow up on that is, would it be advisable to make a little cocktail of, say, some not colloidal, but silvercilin and the
Yeah, you can totally mix and match. That's what I do with my things. I've done straight OG alone just for my own personal reason as far as nebulizing, because I want to see, okay, what happens with that? What do I experience with it? Yes, William?
Can ozonated glycerin deal with blood pressure issues, and how would you administer it, or what way would you?
Question was, can OG deal with blood pressure issues, and how would you administer that? Blood pressure there's a lot of different factors that can be affecting blood pressure. A lot of people think, it's the kidneys, we got the sodium, the potassium, all those things, which is kidney, but a lot of times it's also stress related, can be also cardiovascular. Maybe it's going to help your body utilize oxygen better. Or it's going to give your body oxygen, I should say. So is it going to replace the hypertension meds right away? I would say I wouldn't go down that path. And I haven't seen anything as far as in Doctors Rowan, Schallenberger, they haven't mentioned anything about cardiovascular in that regard. Mm-hmm. Yep. Okay, Eddie, yeah.
I have a question. I'm looking into alternative remedies for like sun damage, and I know you had recommended Equipolitan skin. I've been doing that instead of like chemotherapy, topical stuff. But as far as like how would you what would you for procedure or protocol for that?
Okay, question was for skin damage, like sun damage,
Yeah,
precancerous?
Well, it's interesting when I'm looking into it, I'm noticing that like it could be also related to like staph or candida or like issues around that.
Perfect.
Where the
Okay.
sun damage will go to specific spots. So I'm like, oh, this is, you touched
Yeah.
on that.
Yeah. So the sun damage may be going to specific spots on the skin where there's already some type of staph or candida or something. I think OG would be fantastic. Get the handout and because you can mix OG with DMSO, and so the DMSO is going to draw that solution into the skin more so. That's what DMSO does. It takes it into the body more. So you have to be conscientious about what you put with DMSO. Also buying a pure, like a 99.9%, and ideally I would say get it in glass to make your mixture in glass. But I would recommend doing that topically because one, we already know it's great for cancer. It's going to shrink tumor cells. It's great for any type of infection, staph, candida, bacterial, anything like that. So I would say do that.
So what I'm hearing, like topical.
Topical, yeah.
Is that something we get through you?
You can get DMSO online.
Okay.
Yeah. Mm-hmm. Okay, I think that's it. Okay, thanks everyone.